Welcome to Therapeutic Thursday, where we explore innovative approaches to support individuals with autism and related disorders. Today, we are honored to introduce Tan Hong Chu, a distinguished board certified behavior analyst and a leading expert in applied behavior analysis. With over 10 years of clinical experience spanning the UK and Dubai, Hong has dedicated his career to enhancing the lives of children with learning disabilities, including autism. As the founder and managing director of Engage Behavioral Learning Habilitation Center, Hong leads a team dedicated to providing ABA and early intervention services in the UAE. Today, Hong will share his insights on teaching functional communication using applied behavior analysis approach for children with autism. Drawing upon his extensive experience and expertise, he will guide us through effective strategies for fostering communication skills and promoting meaningful interactions with children with autism. Join us as we delve into the world of ABA with Hong and discover the power of functional communication in enhancing the lives of individuals with autism. So, thank you so much, Hong, for joining us today and further handing over the session to you.
Okay, thank you very much. So my summary about myself is, I'm the founder and managing director of Engage Behavioral Learning Habilitation Center. So these are all my expertise, as mentioned before. So today I'll be talking about how to teach functional communications using ABA approach, and a little bit overview about what is ABA about as well. But first thing first, let's dive in the deeper about what is autism spectrum disorder, because we need to first understand what are the challenges for children with autism spectrum disorder. So ASD, which stands for Autism Spectrum Disorder, is a complex developmental disorder that affects an individual's ability to communicate, interact, and function independently in a daily life. So in other words, it's a spectrum, which means it affects everyone differently. All right, everyone is different and has different likes, has different dislikes, different strengths, different ability, different area that which support is needed. Okay, so that's why we should not treat every single individuals with ASD the same, because they are not the same. Okay, a little bit background about ASD. Autism used to be a relatively rare, almost 1 in 10,000. That was back then in the 90s. But as of 2023, in the CDC reports, it's actually very common. All right, it's 1 in 36. Now, this report is only relevant for in the United States, but in the whole world, statistics, in the approximations, we are looking at 1 in 100 children. So which means it's still relatively common. Okay, but again, we couldn't get the exact statistics because there are still, the awareness of ASD is still there. Some places it's not yet aware in terms of the awareness. Therefore, this is the rough estimations. And again, consider that this is a rough estimation. It is very, very common. As you can see, based on the ASD from CDC reports from early 2000 up to 2020, which is recently, you can see the trend from 1 in 150 to 1 in 36. And more children has been diagnosed with autism. Okay, so really we really need to understand what is actually the challenge of ASD. Now, ASD affects an individual in a few areas: behavior, social, communications, and language. Since today we are focused on teaching functional communications, we'll dive in deeper a little bit about what are the areas of challenge in communications and language. So ASD affects an individuals with their communications. Person with autism may possess some of few combinations or a varying degrees of severity, such as difficulty in expressing their needs. Some of the children with autism has limited vocal expressive language, and some even non-vocal. Some use gestures, hand leading, or pointing instead of using their speech or words. Some may have speech, but they may engage in the form of echolalia. That means they repeat what you say. Or in the form of stereotypy vocalizations, which they will just sing some sound or words, same thing over and over again. Okay? And some, they may have difficulty in reciprocal conversations and social interactions, which means when you try to talk to them, having a conversations, they may not necessarily be able to reply what you say. And I think one of the most common difficulties that we are actually facing is that the speech difficulties. In some forms, some children may have challenges in communications in the absence or delay of speech and language. And this may contribute some behavioral problem because their inability to use language to communicate what they needs. All right. And some even have speech apraxia, a neurological disorder that affects movement in speech productions, which means they hear what you say, but they can't say what they want to say. So these are all the challenges, characteristics they may face as someone that has autism spectrum or someone in the autism spectrum disorder. Again, what happens if we don't do something? They will not outgrow it. All right, they will not. Oh, it's fine. After a few years, they'll be fine. No, they won't. That will not happen to them. They most likely, because of the challenges they may face, being excluded from the environment, from the community, from the social society. So this is why we need to do something. And what can we do to help? Educational psychology services? Is it OT, occupational therapy, speech and language pathologists, and applied behavior analysis? Well, the answer is all of them, but it depends on the needs of the child and what exactly that you need. Therefore, the services required for each child, it depends on the child as well. Now, since we're going to talk about using applied behavior analysis approach today, I'm going to talk about what is ABA and how do we use ABA to teach communication. In applied behavior analysis, let's first understand what is applied behavior analysis. Applied behavior analysis, or stands for ABA, is a science that systematically implements interventions that derives from the principles of behavior to increase social significant behavior, therefore improve their quality of life. So basically, the fundamental of applied behavior analysis is a science, which means it's an evidence-based, right? And we use ABA to study and also to identify the variables that are responsible to our behavior change. So in short, ABA interventions utilize evidence-based practice rather than I think assumption. I think this is good because you want to make sure it is verified, it's been evidence-based. ABA interventions is actually focused on the functions of the behavior. That means we want to understand why do we choose to behave this way? Why do we choose to engage the communication in this way too? And in other words as well, we focus on teaching skills to increase the appropriate behavior and decrease the problem behavior. Let me give you one example of ABA in the daily life. Okay, so in ABA, we'll definitely look at the situations and try to make analysis of what's going on. What's going on here? Why did the child cry and scream whenever the mom actually give attention to the other child, right? So we do analysis. What's going on? How do we change that? How do we teach the communication in these settings? So first of all, let's learn about how do we use ABA to analyze the whole scenarios and situation here. So we use what we call ABC, or some of us may know about this, antecedent behavior consequence, to break it down what's going on. So antecedents, which means anything that happens before the behavior. In this case, as you can see, the antecedent is the mom gave the attentions or attempt to hug the child. So as a result, the child screamed and ran towards his mom, and as a consequence, mom gave attention to the child. Now, if you are parents, okay, or everyone here, as a result, do you think the behavior will continue in the future? I'm pretty sure everyone will say, yes, of course. Yeah, because mom gave attention, isn't it? Of course, it works. Why not? Right? So, using this fundamental understanding of what is applied behavior analysis, we are actually can be applied in the communication too. We call that the verbal behavior. Okay, so Skinner, which is the father of ABA, who founded the science of that. Skinner argued the language that is not innate, cognitive or developmental process. Rather than language is behavior. It's a verbal behavior that's best explained by the same environmental variables that explain all other behaviors. In other words, whatever I show you the analysis of that scenario earlier, the communication side can be explained in the same manner. So for behavioral account, we call this a verbal behavior. Verbal behavior is the behavioral interpretations of language. So in verbal behavior, we don't define the speech or the words they use by its form, rather than we define it by the functions. All right, why does it choose to say these words in this context, and what is the controlling variables? All right, so then how we do is we do analysis of the language, and we broke it down into few categories, and we call that verbal operands. In each domain, we teach the language based on the functions itself. Okay, that means you use it for certain reasons. You don't use language for no reasons. So therefore, in ABA, we focus on teaching language based on the functions. Daily examples. Let's just say, I'm pretty sure now is evening time, or some other places maybe morning. We are looking for coffee, all right? So if you want coffee, where do you go? I'm sure everyone will say, yeah, we go to cafe, we go to Starbucks, if you want to go get coffee, this is where we go. So what do? You go to find Starbucks, you saw a Starbucks, you enter the door, you go to the counter, and you specifically engage the request, the behavior, the request for a coffee. You specifically say, I want a cappuccino, please. All right, you don't say, I want coffee, I want anything. Or you just say, I want tea, but I want coffee. You don't say that. You specifically request for, I want a cappuccino, please. Therefore, you make the order. And then as a consequence, because you request specifically, you get cappuccino as a request. Okay. Now, verbal behavior comes in different forms. Okay, we call that verbal operands. So let me put it this way. If a child says cookie and gets cookie, so there will be more likely to say cookie in the future. So that's how ABA can be applied in the language. Same goes to the same outcome, but different way. If a child screams a cookie and gets a cookie, they most likely will also scream in the future in order to get cookie. So you can see that in these two examples, you see the outcome is the same, but the behaviors are different. So therefore, communication is actually can be defined based on the function itself. And even problem behavior is a form of verbal behavior, because as a result of lack of certain verbal behavior, as the child can't talk, therefore they engage tantrum behavior, it works, therefore I get what I want. So therefore, we use ABA to actually not, how do we use ABA to manage the tantrum is that we teach them how to communicate. So we proactively design a verbal behavior program to teach to replace the behavior. We replace it in a way that, well, you can always communicate in a certain way to get what you want. You don't have to engage a problem behavior, right? Okay, so these are all the verbal operands, as I mentioned before. So we broke it down the language in based on their verbal operands. Verbal operands means the functions of the language. Okay, I'll explain a little bit more about this. So we broke down into a few operands, such as man, tag, echoic, intraverbal, textual, transcriptions, listen, response, which is on the receptive side. Now, of course, there are many more other verbal operands, but this is where we're going to focus today. We're just going to focus man, tag, and echoic. So, man, which is requesting, okay? Requesting an item under the control of the motivations to get access to the item. When you request something, you get what you request for. That is called manding, all right? For example, the earlier examples that I showed you earlier about the coffee, that's a form of man. Examples of man could include cookie, I want cookie please, hitting someone to get a cookie, so that's a form of requesting, exchanging a picture of a cookie, so that in that way you get cookie. So as you can see, now if you have to do analysis based on the requesting in the applied behavior analysis, you can see that John sees a cookie, John wants a cookie, therefore John requests for a cookie, and John gets the cookie. Do you think if I request and I get what I want, do you think in the future you will do the same again? The answer is yes, because your behavior of requesting specifically to get what you want, specifically as well, has been reinforced. So in this case, in the future, you will still do the same to get what you want. Now, the next verbal operand is tag, naming or labeling objects, actions, or events. This is also very important in order to teach the child to be able to understand what's going on in their surrounding, in their community, or what's going on in the world. By understanding, by able to labeling as well, you will help them to understand what's going on, and therefore they will be able to communicate. Okay? So one of the few examples, a child says cookie when sees a cookie. A child says look at a dog when they see a dog. And it would be like, oh yeah, that's a dog. Therefore the child has been reinforced. Okay? So this is another example how we break it down in a verbal operand to the behavior. John sees a cookie, John says a cookie, and John gets praise. Okay? You see that I'm using one example, cookie, across mending and tag. You see how we can analyze the language based on the function itself? That's another example here. Now another example for you, echoic, repeating what is heard. John hears cookie, and John says cookie, and John gets praise. You can see that now John's behavior has been reinforced because when he hears cookie and he says cookie, and therefore he has been praised. Okay? So with all three basic examples for you to show how we can utilize verbal behavior actually to train languages and communication here, by breaking down based on the verbal operants, which is the function itself, we are able to teach language in the different manners. Okay? Now, the question here is, where do we start? First of all, parents and anyone who is in the field, we need to identify the forms of communications. There are three common types of communications that we use to teach the child to communicate. The most common one, vocal speech. If a child is non-vocal, of course, the first thing that we want our child is to be able to vocally talk, right? Use their speech to talk and communicate. Sign language, and of course, alternative augmentative communications, AAC device, comes in many different forms, okay? So I broke it down in a table for you all to see what are they, and what is the pro and cons of using it. Now, of course, in a vocal speech, it's very common what we are doing right now. The pro is commonly understood by anyone who shares the same language. So if you're using the same language to talk, you will be able to understand each other. You will be able to communicate each other. Of course, the cons is you need to make sure that you have up-to-date development and oral motor muscles to produce the clarity of the sound. Otherwise, if I can't hear you clearly, I wouldn't be able to understand what you say. AAC device. Using AAC alternative augmentative communication devices to communicate, such as visual communications. I think most of us know what's PACS, right? And electronic devices using the iPad to actually produce the sound and the picture as well, such as Protocol to Go, using those software to actually produce the speech generated device. Now the pro is it's easy to understand because all you have to do is just press it or give the pictures. Anyone who knows the items, they will be able to understand what do you need. But the cons is you need device. You need to have the technology, the low tech, the high tech. For PACS, you need to make sure you have a PACS book. You need to make sure that PACS picture is there. If the picture is not there, you can't communicate. iPad, if the iPad is is not well equipped with the software, you can't communicate. If the iPad somehow lost in where you are bringing the iPad is, then you can't communicate. If the battery of the iPad is is already there's no battery of the iPad, so then how can you communicate, right? So you always need a device. Sign language, using body motor movements to sign different forms to communicate. The pro is, yes, you can communicate far away. I used to be able to communicate someone with signs just right across the road, and just doing some sign, I already know what you want. It's instantaneously and without needing a device. But the big con of this is that you require a complex motor skills. That means your motor skill must be able to be fluently to perform the form of the signs, and only people who is within your community will be able to understand what you want. Okay, so not many people will be able to understand your sign language as well, unless you actually learn the signs. Okay, now of course the question here is which form to choose. What kind of form do we need to choose to communicate here? Now, depends on the child's ability and their environment. If your child is non-vocal, I highly recommend to figure out, start from where they can do first and build up the language and communication. Okay, because communication is very, very important to them. In the end of the day, speech is just one of the forms of communications. If your child doesn't have the tools to communications, what's going to happen? The challenging behavior most likely will come in, because every child has their needs. If they can't communicate their needs and they attempt to engage in problem behavior and challenging behavior, as a result, they get what they want. Now, it shows to them that, well, I can't talk. I can't, I'm frustrated, right? If I can't communicate, I can't talk, what can I do? The best way is just engage in problem behavior and I get what I want. All right. So that's the danger of that. So this is why it is so important that we design a communications for them so that they are able to communicate. Communicate is more important than the speech. Okay. So functional communication training. What can we do to train them how to communicate? I broke it down into three key strategies here. All right. The first thing, follow motivations. All right. You don't communicate if you don't have the motivations. All right. We, most of the time in the day-to-day scenarios, we only communicate when we want something, we need something, or we get away from something, right? If you want coffee, you ask for coffee. If you want cookie, you ask for cookie. If you want information, you ask your colleague or anyone else for the informations, right? Or you engage certain behavior just because you need to escape from something, or you just, for example, reading, if you just read because you want to escape from something, right? Or you just read because you want to get something else. So there are motivations to teach communications, and we need to follow that motivations and using the motivation to contrive and teach them how to communicate. That is the second point, which is contrive for multiple opportunities to request or communicate. All right. Now, one of the biggest things that we really need to do is to control access. All right. What does that mean is that most of the time, if let's say a child has free access of getting what they want, do you think there's a need for them to communicate? No, the answer is no. Why should I communicate when I can just get it? Why should I ask for it when I can just grab it? Okay, so this is why you need to be able to control the access. By controlling access doesn't mean that you don't give it to him. You are just setting up a barrier, okay, so that he has to engage a certain behavior in order to get what he wants. And that barrier is a crucial opportunity for him for communications. Okay, so for example, if a child wants a cookie, you put somewhere else that's high enough so that he will be able to request for cookie. All right, so get him to say cookie, and then he will say cookie. Yes, there you go. Give cookies. All right. Now, you contrive for multiple opportunity doesn't mean that you can just try once or twice and it'll be fine. But in fact, you have to try to practice multiple times. Okay, because in the end of the day, if the child is communicating under your prompts or anyone's prompt, he is not considered learn the skill yet. All right, he's not able to communicate independently. So this is our goal. You should be focused on practice and practice so that in the end of the day, the child will be able to communicate independently by themselves without any prompt. So therefore, we need to practice a lot of times. And also the tip here is you need to start easy. All right, let's start with one word first. Don't go straight away with the phrases I want something when the child can't really talk or the child can only produce a certain sound. Don't go straight to I want. Start with the one word, and that one word is exactly the keyword for him to get what he wants. For example, if he wants a cookie, just say cookie. That's it. Start with that. Doesn't mean that we don't want to increase the phrases later. Okay? We want to increase the phrases, but you want to start with easy first. You want to tell the child communication is more important. You want to tell the child communication is effective and efficient to get what you want. If you just say cookie, you get the cookie right away without any delay, rather than if you hit someone, you don't get a cookie, correct? So this is why it is very important. You've got to start easy, reinforce a lot, which is the next tips here, which is you got to reinforce immediately, okay? Give it immediately, don't delay, just deliver immediately and followed by the praise, okay? As you strengthened the behavior, remember, communication, speech is a form of behavior too. you specifically choose cappuccino. You choose the word of saying cappuccino to get what you want, which is the cappuccino. Remember that. So therefore, every behavior has to be strengthened. You have to reinforce the behavior. Okay? So by doing all 3 steps repetitively, okay, break it down. All right, start easy. First thing first, identify the forms, follow the motivations, contrive multiple opportunities to communicate and reinforce. Try that multiple times in your natural environment teaching, okay? Kitchen is the best place to start if the child who likes to eat. You can bring them to community as well, can teach them in the supermarket. These are all the places to communicate. Now, the key message for today is we want to focus on teaching communication functionally rather than fun. Rather than teaching them exactly that what you need to say, we focus on communications, right? And communication has 3 different types. What is useful that we want to focus on what actually is useful for them based on the 3 different types of communication and what they can do at the moment. All right. Now, bear in mind, what I'm trying to say is that sometimes we should consider alternative communication options as well. Doesn't mean that we will want to give up the speech, but we also have to consider that communication is more important at the moment. And in the same time, of course, you can focus on teaching the speech, right? So by the means, if the child has the right tools to communicate for themselves, they will be able to communicate. And of course, without me saying, communication is very, very important because by being able to communicate, this will help them to fulfill their needs and reduce the problem behavior and increase their quality of life. Okay, so I'm going to sum up a little bit of summary here. My last important message for today is that give them the right tool to communicate. It's almost like giving them the voice to advocate for themselves. Okay, so yeah, any questions? Okay, I think I got one question here. What teaching methods and strategies are commonly used in ABA program to teach functional communications to children with autism? So, as I showed a few slides earlier, I think these are all the slides. Let me put this. Okay, so these are some of the teaching methods. Okay, now of course you can also use, first of all, I think what we really need to do is we need to analyze what's going on with the child first. All right, we need to know what is the child's ability, and based on what the child needs, then we have to personalize the different methods and strategies. So what I give here is a general strategies for today. Of course, you can use many different strategies like prompt, make sure you fade out the prompt. And then reinforcement is very, very important. I highly and also stress this about, because when the child communicates at that moment, all right, you need to make sure that you deliver what they want immediately, because the delay of a reinforcement will actually tell the child that the communications, whatever he's doing, is not effective. All right. Okay, so we also got another questions. If it's okay, what are your views on the oppositions that ABA therapy faces? Well, to be honest, today our focus is more on communications. This can be an entire topic by itself, but I'm just going to be summarized a little bit here. First of all, I think from my perspective, because I can be a little bit biased, but then from my perspective is that ABA is a science itself, all right? And I think the oppositions that we really need to think about is that first of all we need to understand where are they coming from, what are the experience they have experienced that why ABA therapy is you know is kind of against to them. But I think we really need to understand that first. But from my perspective is, or to the people who are going against the ABA, I would suggest understand how does ABA works, and also seek for advice actually, trying to understand when you apply behavior analysis, okay, the apply behavior therapy. I think one of the most important thing is we need to understand why it doesn't work for your child. Okay. All right. Any more questions?
Hi Hong.
Yeah.
I do not see any further questions on the live streaming. So I would ask the audiences in case if they have any further questions, they can add it in the comments box below. And we would be getting in touch with Hong to get all of them replied and answered. So as we conclude today's session, I hope everyone found exploration of innovative approaches to supporting individuals with autism and your expertise like as a board certified behavior analyst has shed light on the importance of ABA in providing effective interventions. So that was really amazing for us as well the audiences to hear so much of insightful knowledge, and thank you so much for joining us today and sharing your expertise with us, and thank you so much to all the audiences who have joined us today. Until our next time, may we continue to explore and implement innovative ways to support individuals with autism. So take care and see you next time.
See you. Have a good day.
Yeah, you too. Bye.
Bye. To teach functional communications to children with autism. So, as I showed a few slides earlier, so as I showed a few slides